All right, I'm going to hit the recording right now so that we can get going. And I'm going to share my screen and go right to this. All right, so thank you all for joining us. I'm sure there's going to be a few more people joining us little by little as we go by here. We had 40-some people sign up on Zoom. We never get everyone that signs up to show up, but I'm assuming we're going to have a really good group tonight. I want you to know that when we do these workshops in person, it's really easy to interact because we can see the whites of each other's eyes. And I even do some demonstrations on people. It's harder to do that in an online setting, but we're still going to interact. So some of you have already used the chat feature. If you ever have a question, just hit that chat icon and you can type your question in, and it will alert me that you've left a question. And then I'm going to give you the opportunity to contact me directly after the workshop too. I'll give you my email address, my cell phone number. So if you have specific questions, you can ask those. At the end of tonight's workshop, I usually stick around for a while because people generally have questions, and I want to be a resource for you. So I will stick around and I'll answer any questions you might have. Let me give you just a really brief introduction about who I am and why you should listen to me. I've been a physical therapist for a long time, 24 years. I graduated from the University of Iowa and then did some postgraduate work to get my doctorate of physical therapy, a degree as well. So I've been doing this for a long time. I am happy to say that when I was a young physical therapist, I worked with a lot of people and a lot of them got better, but they got better because of me in some cases and despite me in other cases. I have learned a ton about the human body from seeing so many people over all these years. And obviously arthritic issues are very common. In Iowa in particular, we have an elderly population, and you will see tonight that as we get older, the chances of experiencing arthritis go up. So I've had plenty of opportunity over my 24-year career, nearly 20 years with Kinetic Edge Physical Therapy, to learn about this condition, and I'm happy to share some of the pearls of wisdom that I've gathered through all that time. Our practice is called Kinetic Edge Physical Therapy. We've been around for, well, it's approaching 22 years. We have 7 clinics. We have 19 physical therapists plus occupational therapists, assistants, a lot of people that are highly trained, and you'll appreciate later on tonight how we focus on what's called 3D movement analysis. And why this is important is because your arthritic joint doesn't need to work laying down or sitting down, although it does, but most of the time we spend our time on our feet. We are between gravity and the ground. And the stresses on our joints when we're between gravity and the ground are different than we're sitting down and when we're lying down. And so understanding how to assess and to enhance your ability to move efficiently 3-dimensionally is exceptionally important. So we focus heavily on that with our team members. We're also clinical educators for many PT and OT programs. And that's great for 2 reasons. Number one, we're honored that these programs trust their students with us. But most importantly, we learn through that experience as well. These students are bright, they're inquisitive, they ask a ton of questions, and we have to be ready with the real answers. And so it keeps us on our toes. We're really excited to continue to do that. I want you to know that this workshop is designed specifically for you. If you're finding that because of your issues with arthritis, you're having a harder time doing the things that you want to and love to do. And that's a bad deal because that means that you don't do as much as you'd like and you become a little bit more dependent upon others. So if you want to become dependent upon yourself, this is a good place for you to be. A lot of people that have dealt with this arthritic issue will ask, man, what do I need to do? I've tried everything. Is this pain ever going to go away? Or maybe do I need to have a surgery or something to make this feel better? Is there something I can do that way? Some people even go the next step further and understand, hey, I'm not moving like I used to. I can't do what I used to be able to do. What's that going to do to my overall health? So if you find yourself asking questions like that, this is a great place for you to be because we're going to cover some really important stuff about those issues. One of the truths that we'll talk significantly about tonight is the fact that in your body, A joint is influenced by more than what's happening at the joint. It's influenced by what's happening around it. That joint is influenced by its environment. You'll learn about how each joint is part of a dynamic system that makes up a functional unit, your human body. Now, this is true about your body, but it's also true about you. And if you are hurting, if you're having issues, it's going to make you be in a bad mood, and it negatively affects the people around you. And if you can move better and feel better, it's easier to positively impact the people around you. So I want to give you strategies to be a positive influence on those around you, which will help you take better care of yourself and your family. I also want to talk about there are some negative side effects associated with medication. There are some risks associated with surgical interventions, and I want you to avoid side effects and risks as much as possible. And there are means of improving the way you function and the way that you feel that involve no medications, no injections, and no surgeries. And I want you to hear that tonight, because I think that's the most natural way for you to move in a pain-free or pain-reduced way. Now, some of you may be here and it might not be the right place for you to be. If someone's making you listen to this information and you're not into it, then you're probably not ready to hear what I'm going to talk about tonight. I wish I had a quick fix answer for you. I really do. But we are going to learn tonight about how most musculoskeletal issues, including arthritic problems, are cumulative in nature. And that means they come on slowly over a long period of time, and they worsen as time goes by. And there is no quick fix for something that is cumulative. Something that fixes that which is cumulative needs to be done in a cumulative way as well, okay? And I can understand if you're just sick and tired of hurting all the time, man, I just want to have a surgery and get this over with. I understand that line of thought. Unfortunately, I've been around long enough to know that a lot of people pin high hopes on surgical procedures and don't get the outcome that they're hoping for. And I don't want you to have false hopes. So if you believe, hey, I need to just deal with this, I need a surgery, I'm going to tell you that in rare cases that might be true, and lots of times it is not true. All right, I'm going to have you use that chat button right now. I'm going to ask you 3 questions, and I want you to give me feedback on this if you would. So hit that chat button and tell me, what kinds of activities do you do that make your arthritic problems worse? Okay, is there one activity in particular? Tell me what that is. Then tell me on a 1 to 10 scale, 10 being emergency room pain. How high does that pain get for you when it's really worked up? And the third thing I want you to say is, how long have you been dealing with this arthritic pain? Did it begin a week ago, a year ago, years ago? Those 3 questions, your answers to them are really important. What activity causes it? How high does the pain get on the 1 to 10 scale? And how long have you been experiencing it? Please write that down in the chat if you can. And I want you to know that these answers are really important to me. We ask these questions to everyone that comes into our clinic because they're important questions. Based upon your answers, I can tell you if what we're going to talk about tonight can help you. And so please click on that chat button and tell me, where's your pain? What makes it worse? How bad does it get? And how long have you experienced it? You got any brave people out there? I know we've got, lots of people on our call tonight. Got anyone willing to be brave and provide for me some of that information? I'm not afraid of silence here. So we're going to hear a lot of you talk about pain in common areas. Probably the most common areas we hear about arthritic related problems would be in the back, in the hips, and in the knees. But I know we have at least one person here tonight that's been dealing with hand and finger related arthritis as well. In many cases, the stuff that impacts your fingers may be different than the stuff that impacts your back, your hip, and your knee. A lot of times people will tell me it is weight-bearing activities that make those extremity issues worse, back, hip, and knee problems. Although if you're having hand issues, heavy use with gripping and pinching tasks are probably going to be your problematic area. And if your pain's been around for a few weeks or a year or less, that generally can be fixed a little bit more easily, a little bit more quickly. But don't fear, even if it's been around for years, anything you can do to take stress off those joints that are in pain because of the arthritis will be beneficial for you. The bottom line answer is this. Though it sounds counterintuitive, there are specific things that you do that make you hurt the worse. That's actually a good sign, because we know if your pain is reproducible because of a specific activity, it's also reducible. So I wrote a bunch of things down there. These are things that we hear a lot, particularly in people that have knee arthritis, ankle foot arthritis, or hip arthritis, and back arthritis as well. But I want you to know that if something makes it get worse, and then avoiding that something at least temporarily feels better, that's a great sign. First of all, I know that you have an issue that is mechanical in nature. With mechanical problems, certain kinds of stresses will make it hurt worse, and the reduction of those stresses will make it feel better, and that's a good thing. That means we got to find ways to take stress off that arthritic joint, and reduction of stress means a reduction in inflammation and a reduction in pain. So what we're going to learn about today is what you can do to heal naturally without medications, injections, and surgery. We're going to talk about what arthritis is, and most importantly, what effective treatment for arthritis looks like. But let me start by showing you the difference between what we call acute trauma and cumulative trauma. And I'll start by saying cumulative trauma, that's what arthritic-related issues are. Arthritis does not appear one day after being not present the previous day. Arthritis is a gradually progressing issue. Acute trauma is tissue damage that occurs very suddenly. This is what acute trauma looks like. You do something that overstresses a particular body tissue, and you hurt that tissue. There's tissue damage. The cause and effect is immediately noticeable. The neat thing, I guess, about acute trauma is because it's one issue that brought it on, when you're done experiencing that issue, the body will naturally heal. So acute trauma leads to a natural healing response. Unfortunately, cumulative trauma, and arthritis is almost always a cumulative trauma. Cumulative trauma is something that over time tends to worsen. It doesn't naturally heal, it naturally worsens. So we're seeing this over time, little changes happening to your tissue. You can see that there's stuff happening before you even get above that symptom threshold. When you start to get above that symptom threshold, now you're starting to notice signs and symptoms related to the problem. But the problem has been developing below the symptom threshold for quite some time. So it makes cumulative trauma, arthritic issues, more difficult to deal with because they're a little bit more insidious. Now, even though they're insidious, meaning they kind of happen slowly and progressively, they are very predictable. And this is what we see. I'm going to use a bucket analogy here with this. So you got a bucket, you got a relief valve in there, you can empty some water, you got some water filling that bucket. As your body changes, there are very predictable things that you will notice as you think back on your cumulative trauma arthritic experience. Can you say at this time in your life, you have, at the end of the week, or after doing a particularly demanding task, you have more fatigue now than you would have when you were in your 20s? Well, obviously that is the case. I'm 48. I'm sure I have arthritis in different body parts. My job as a physical therapist is not physically demanding in most cases, but just living life means there's gonna be wear and tear. So for sure, I notice even now at the end of my week, I have more fatigue than I used to. Because it happens so subtly, because we can easily excuse a little bit of fatigue, we keep doing the same things, we experience more stress and more water fills the bucket. Now I'm starting to feel a little more stiffness and soreness, okay? And that's interesting and not comfortable, but it's not really pain. The next step is pain. Pain is different than stiffness and soreness. Pain hurts. And if there's any good news about pain, in most cases with cumulative issues like this, it precedes true tissue damage. And that means if you can respond appropriately when you have stiffness, soreness, and the beginning of some pain, you got a good chance of getting better again without experiencing true significant tissue injuries that take a lot of time, energy, and money to fix. Okay? Unfortunately, though, most people just continue to experience the same physical stresses. And we see in the clinic, people with this condition will tell me as time goes by, the pain becomes more frequent, it becomes more intense on that 1 to 10 scale. And when it comes on, it lasts longer. The duration is more significant. It takes less to set it off as well. That is what naturally happens. So you see my screen here. The backdrop is the train tracks. We're standing on the train tracks. If you look in the distance, there's a train rounding the bend and coming at you. If you continue to experience the same things you've experienced that have gotten you to this point, it's going to continue to progress with regard to frequency, intensity, and duration. That is almost a given, okay? And we know it's going to make you angrier, more frustrated, your mood worsens, your overall physical activity reduces, which unfortunately increases the likelihood you're going to have more significant health problems. We'll talk about those things in just a little bit. It increases the chance that you're going to have a high-risk procedure, some kind of a surgical procedure, which unfortunately in most cases are not as successful as we want them to be and expose you to risks that you'd prefer to experience. So if you follow this structured process, I think you're going to be able to reduce pain because, and we're going to hear about this, arthritis is a mechanical issue and it needs to be treated like a mechanical issue, meaning it's related to movement. Now look at the bottom here. There are 6 things that Americans spend most of their healthcare dollars on. 86% of our healthcare spend is on these 6 issues. Musculoskeletal issues are easily number 1. Arthritis is a form of a musculoskeletal issue. And then we have heart disease and cancer as number 2 and 3. And then it goes diabetes, obesity, and depression, 4, 5, and 6. Every one of those conditions, maybe the least so being cancer, although there's a relatedness between activity level and cancer risks too, some cancers. But every one of these issues, musculoskeletal problems, heart disease, diabetes, obesity, and depression, are positively influenced by being able to move well. And so I've let the cat out of the bag. Tonight is all about teaching your body how to move the way it was designed, how to make it move better. That is the only real solution over the long term. And I'll tell you, in my clinic, over the years that I've done this, I've seen way too many people who are 60-year-old, 80-year-olds. So what do I mean by that? Chronologically, they are 60 years old, but their body is behaving like they're 80. So here's the problem with medical advancements. Medical advancements allow us to live longer, but it doesn't necessarily it adds years to our life, but it doesn't necessarily add life to our years. A lot of people are living longer with things that are difficult to live with, and that is a challenging situation to be in. And unfortunately, human nature says when we start to experience any kind of a problem, in this case, I'm using the musculoskeletal arthritic issues as a problem, but the natural tendency initially when we start to experience this problem is to ignore it. That's the single biggest mistake that most people say. They don't just ignore it, they make excuses for it. Maybe you can relate to these excuses. I hear them a lot. You know, I'm not as young as I used to be, and my mom really had bad arthritis, so it's probably genetic. I worked really hard, what do I expect? All those things are perfectly logical. In some cases, they may even be partly true. But I want to tell you that ignoring the problem and making excuses for a problem do nothing to fix the problem. And ultimately, most of you that are here probably have already gotten to the point where we get to that next step. But the second step is, I'm going to look for something to help it. But most of the things we seek to help this arthritic issue simply mask the problem. It just alters the problem. It does not get to the root of the problem. So go online and type in relief of arthritis pain, and you're going to find out that the arthritis solution industry is a multi-billion-dollar industry. There are lots of people making lots of money on solutions that don't really fix the problem. At best, they can provide some temporary pain relief, but my encouragement is you've got to get to the root of the problem. That's what we're going to talk about tonight. That's the only way to solve it. So I'll say it again. I said it at the very start. Some of you may not have checked in yet. I can't tell you everything over the screen tonight that you're going to need about your particular condition. You're going to learn a lot, and a lot of good stuff. But if you really want to take this and do everything you can to eliminate it, get to the source of the problem, the root of the problem, I'm going to encourage you to spend 20 minutes with one of our arthritis experts. And again, it's at no cost or obligation, and you'll be able to learn exactly what you need to do to take stress off the joints that are hurting. And there is a key for you that is unique to you and how to do that we need to find by looking at how your body moves. So if you want to take me up on that, you can click on that chat button and say, okay, I'm in, I want to have that. And we'll get you at one of our closest clinic locations, or we even have an online version if you want to do it that way too. Again, I think that's the best way to get to your problem. But I want to make a key point first here. I've already talked about mechanical issues. Too often, unfortunately, we treat a mechanical issue, anything musculoskeletal, most arthritic issues, like it's a medical problem, and you cannot solve a mechanical issue with a medical problem, okay? It's easy to pop some pills like anti-inflammatory over the counter, an NSAID, like Advil or something like that. And that might make you temporarily feel better, but if you look at your body, you don't have a dashboard and say, oh, look at that, I'm low on my anti-inflammatory pill. I gotta get some ibuprofen in me. That's not how it works. That's simply trying to mask a biomechanical issue with something that's biochemistry focused. It's a movement-based issue, and the only way you're going to solve the problem that's movement-based is to learn how to move in a way that you can do so efficiently and effectively while reducing the mechanical stress on the joints that are crying out for help. So I want to talk a little bit about the role of inflammation. Okay, so we take ibuprofen. A lot of the medications that we get prescribed to us are anti-inflammatories. But look at the 4 phases of wound healing, or any kind of healing. Notice the second phase. From days 3 to about the end of the 3rd week, there's actually a phase called the inflammation phase. So that should tell you that inflammation serves a purpose. It's a natural response when our body needs to heal. It is through inflammation that we begin to prepare for this matrix of blood vessels that will grow in that tissue, which is exceptionally important. It's the only way to maintain tissue health, because those blood vessels carry blood. And in that blood, we have oxygen and all the other nutrients that tissue needs to stay healthy or to get healthy again. So if we take an anti-inflammatory and stop the inflammation process, we don't proliferate and remodel. That process doesn't complete itself, and those tissues do not get the nutrition they need because this matrix of blood vessel growth has been stopped. Okay? So I understand why people want to take anti-inflammatories. I understand why medical professionals want to prescribe anti-inflammatories, because inflammation creates pain. But unfortunately, the inflammation phase allows the body to do what it's intended to do to make it feel better. One of my favorite authors of all time is C.S. Lewis. Maybe some of you have heard of him. He has been passed away for many years. He wrote mostly in the 30s and 40s, I believe, maybe into the early 50s. He has many books, but the thing that I'm pointing out here is that essay that was written during World War II entitled Miracles. And he said in that essay, the magic is not in the medicine, but in the patient's body. What the treatment does, or I would add what successful treatment does, is to stimulate nature's functions or to remove hindrances to the body's natural functions. And so anti-inflammatory medications don't stimulate nature's functions, and it doesn't remove a hindrance. In fact, it removes a necessary and important part of the healing process. And so if I'm going to do anything good for you, I'm going to teach you how to enable your body to do what it's designed to do, what it's created to do. And unfortunately, the way that we move typically is allowing you to experience physical stress in an area that's crying out for help. Okay, so let me give you an example. Pretend we have 3 people on an assembly line, okay? And the product comes down the line, and these 3 people together work together to do whatever they need to do to that part, to that unit, okay? Then it goes down the line and gets packaged and shipped. Let's say for a moment, one of those people said, you know what, I don't feel like doing it. The other 2 got to pick up the slack, okay? So after a week or 2 or maybe months of this, the 2 people that are working extra hard because this person is not, are going to start to wear out. And if I'm their supervisor and I go to them, man, you're working hard. Oh, I can tell your shoulders are tight. I've got to rub that down. Maybe we can give you some pills here. We are not getting to the root of the problem. Those people, if they're understanding what's going on, they're going to look at me weird, and they're going to point to this one and say, hey, that's the problem. And this is what happens in your body all the time. Okay, if you have arthritis affecting your knees, your hands, your hips, your back, the question you need to ask is, what's not doing its job that's causing my back to have to pick up the slack, my hip to have to pick up the slack, you name it. That is most often why there are people that have arthritis and also other people that have arthritis and pain, okay? So we need to get your body doing what the body is naturally designed to do. And I tell you what, this is why I do this. And so I want you to hear me very closely here. I have 3 really close friends that are doctors, 2 family practice doctors, 1 emergency medicine doctor, and lots of acquaintances that are doctors. I am absolutely amazed at the breadth of knowledge that they have about the human body. It's freaky. But it hurts when I move is the second most common reason someone goes and sees their family doctor. Guess what? Those doctors are not equipped. They have not been trained to deal with musculoskeletal issues. There was a study done a few years ago. They had second-year medical students at the end of their second year. So they'd gone through most of the book training they're going to do as they start to add practical training to their medical training. And they had them do a musculoskeletal quiz or exam of some sort. The average score amongst these highly trained medical students was like 57%, might have been 52%. It was a failing score. Those that got the closest to passing, 67.1% average, were people that had taken an elective musculoskeletal course, which is not common. So the number 2 reason that people go see the doctor is for something they are not equipped to handle. And that means often we get prescribed medications, diagnostic tests, and get sent to specialists. And specialists often mean surgery. Surgeries are increasing significantly, but there's not great results with many of the surgeries that we do for arthritic-related problems. We're going to talk in a little more detail about the opioid problem. And I'm going to hold on that right now, but this is a major passion of mine because opioids, they're a major problem that are not just preventing people from getting the help they need, but they are killing people. And it doesn't do anything to help the real condition. If you have an arthritic issue, if you have a musculoskeletal problem, it's almost always a movement issue. And movement issues need to be dealt with by movement experts to take the stress off that joint. Doing anything else and expecting a different result is insanity, says Albert Einstein. All right, so let's get in earnest. We're going to talk about arthritis and what it is. We're going to talk about the common treatments, but also successful treatments. And those are 2 different things altogether. And then we're going to talk a little bit about the 3 most common causes of arthritis as well, in addition to the types. When we talk about arthritis types, it's simply a description or a diagnosis. If you say back arthritis, pain relief, if you put that in Google, you're going to get lots of answers to that. That may be appropriate for you or not. You can only treat your condition if you understand the cause. So later we'll talk about the cause, but let's talk about the labels first. First of all, I want you to understand that arthritis itself it's an umbrella term that covers a bunch of different types of problems. Arthritis, obviously, you see the ITIS, and many of you will know itis stands for inflammation. So arthritis is an inflammation. Arthur, that's your joint. So literally, arthritis is joint inflammation, okay? And then we've got 3 types that are the most common. There's osteoarthritis, easily the most common. There's rheumatoid arthritis. That's an autoimmune issue. It's not as much related to, in its origin anyway, wear and tear issues. But both rheumatoid arthritis and psoriatic arthritis, which is also an autoimmune issue, a general health-related problem, not a specific joint-related problem. They are not primarily caused by wear and tear, but they are significantly influenced after they've come on by wear and tear phenomenon. But I want you to know that arthritis is, we're learning, very normal part of aging. In fact, in a little bit, I'll show you a picture that says it's as normal as wrinkles on the skin. It's like gray hair, okay? It is more common for people to have arthritis and no pain than it is to have arthritis and pain. Osteoarthritis, we know that arthritis is joint inflammation. Osteo refers to the bone, so it is a bone-specific joint inflammation. It is estimated, at least some places will say 30 million US people, about 20% of the US population. I'm going to tell you, I believe, and I think evidence is coming out to tell us it is way underestimated. So I think this 20% or 30 million is related to people that have pain related to arthritis. But arthritis itself is exceptionally common. And here's some statistics for you. This is looking at people's backs. You're going to see a word up here at the top. It says asymptomatic, okay? People that are asymptomatic don't have any pain. So this is the prevalence of arthritis in the spine amongst people that have no pain, okay? So you see, when you're 50, we're seeing 60s, 70s, 80%, depending upon what type of arthritic issue we're talking about. And it obviously goes up with age. So do wrinkles, by the way. So these things are really, really important. One of the points I want to drive home is this. The presence of arthritis on any diagnostic test should be considered normal, okay? And you cannot treat a sign. You can only treat a symptom, and that symptom, as we'll learn, has to be treated based upon the cause, which we'll talk about later on today. There are risk factors for osteoarthritis, and these in some cases can be modifiable. If it's a wear and tear phenomenon, obviously being overweight on a weight-bearing joint is going to enhance the wear and tear process. There's lots of research out there that shows mild to moderate strengthening enhances function and reduces pain associated with arthritis. We're talking a little bit about the cycle that occurs when we start to experience arthritic-related pain and why it leads to a downhill spiral of events, something that can be eliminated. Many chronic disease conditions contribute to it, like hypertension, diabetes. By the way, those are all modifiable. Those are all related to other things that contribute to arthritis, like diet and exercise. Some aspects of your environment. So life stresses, by the way, or just general stress can affect that. Smoking is associated with it too. There's some non-modifiable risk factors too. Previous injuries, you can't make those go away, although I would tell you, previous injuries become a problem if those injuries are not rehabbed well enough to reduce the impact of the movement inefficiency that can often be the result of that. Age, of course, is a non-modifiable one. Being female, you're more likely to have arthritis if you're a female than if you're male, which would indicate that it might be related to some hormonal issues as well, which there's some truth to that. Okay, so we're going to focus on tonight is what is modifiable, what we can do. Now for osteoarthritis issues, you can see hip, knee, and back are the three most common. Necks and shoulders are right up there, just below that, and then we get to hand and finger issues as well. Although I would tell you hand and finger issues are oftentimes not osteoarthritis related issues. The signs and symptoms of any joint arthritis are loss of motion or stiffness, closely related, and then swelling as well. So if you have arthritis, inflammation of the joint, understanding that swelling is a sign of that, that makes a lot of sense. Okay, so you can look at a hip joint right here. This is a normal, actually I shouldn't say normal, this is an exceptionally healthy hip. This is actually probably more normal amongst people 50 and above. The cartilage is starting to erode. You're getting a little loss in that space between the ball and the socket in that particular area. Okay, now you can look at that and say, wow, that's not good at all. But until you understand that if we start to take pictures, x-rays or MRIs of people that are experiencing no pain at their hip, 50, 60, 70, 80, 90-year-old people, the rates are high and go up as time goes by. So it's really common to have that. So osteoarthritis is the single most common, but there's another one called rheumatoid arthritis, also very common, though this is more systemic disease issue. It's autoimmune. This is the type of arthritis that most often affects smaller joints in the body. So you're talking about your hands, the wrist, your feet. In fact, the makeup of your foot is very similar to the makeup of your hand, those smaller joints. Rheumatoid arthritis is most common between 40 and 60, although there is a juvenile version of this that can affect younger kids as well. There's usually, over time, the increased likelihood of other issues that are affected by this autoimmune disease. It affects your eyes, your cardiovascular system. And one of the most common complaints amongst people with rheumatoid arthritis is general fatigue. In fact, I think a lot of people will sometimes be told they're fibromyalgic or they have fibromyalgia before it's known that it's rheumatoid-related issues. Okay? Then there's this thing called psoriatic arthritis. And so psoriatic arthritis is related to psoriasis, which is a skin condition. So you can see some psoriasis of the right leg worse than the left leg in this particular person. Now, not everyone that has psoriasis has psoriatic arthritis. It's about 10 to 30% likely that you'll have arthritis with the psoriasis, but most people do not. This is usually a younger person issue. Most of these people get diagnosed sometime in their 30s, before age 40. For this, and by the way, for all arthritic conditions, exercise is exceptionally key. Because what if your body doesn't do because of discomfort, it will change and adapt to what you ask it to do. So that's why 60-year-olds feel like 80-year-olds in many cases. You're also going to see some nail, finger, and toe-related issues in a lot of people that have psoriasis as well. So there are some common misconceptions about any form of arthritis. We hear things like bone on bone. I'll talk about that in just a little bit. Some people will say, oh, that's automatically, you got to have surgery about that. That's not true. Some people will say, well, my knee or ankles, they pop a lot. You hear a lot of noise. I must have arthritis. Not necessarily true. You can't do anything about it. I'm just going to have to learn to live with it as a common myth. That is absolutely false. And it progressively gets worse. I will tell you that is the most common pattern, but that's because all too often people don't find the real solution to their issue. And I can say at the very least, slowing the progression is something that every one of you here can experience. This is a knee joint. Okay, what does a healthy joint look like? What you're going to see here is nice amounts of joint space. So there's a gap here between your femur and the tibia. That's well maintained in this arthritis. You can see the relationship between that. Now this joint is surrounded by fibers that enclose that capsule. Inside that capsule we have fluid that's called synovial fluid. Synovial fluid is made up of a lot of things. The most significant ingredient is water. And there is something about the synovial fluid, we'll talk about that in a little bit, that's commonly present when people have arthritis. And it's not necessarily related to the wear and tear process that you experience that. Okay, healthy joints tend to move better. Joints are made for space and for movement. And so normal range of motion is present in those healthier non-arthritic joints. And I will tell you that healthy joints almost always have friends that treat them well. And what I mean by that is, in this particular case, your knee functions well and has reduced stress on it if the hip above and the ankle foot below are each doing its job well. That's the 3 people analogy that I gave you at the assembly line. So this is what unhealthy joints look like. Here's the same healthy joint, and here's one that you could definitely see. There's a loss in discs or joint space. This is on the medial or inside of the knee because your fibula is on the outside. You can see that there. This is normal joint space in the hip. Now we can see that's closing in. And there's little whiter, thicker areas there that are denote that there's some osteophytes forming or some bone spurs in there too. It's easy to see arthritis under an X-ray, okay? What you can't see is that there's joint swelling and inflammation, although you might, if you did an MRI, you might see some evidence of that as well. There's, in the knee, and for example, there's cartilage in between the 2 condyles of this femur bone. That's called your meniscus. And then there's cartilage that lines the joint itself. It's called articular cartilage. If you look at that under, not an X-ray, but with something like an MRI or a scan of that sort, you'll see evidence that that cartilage is wearing out. But I will tell you, the wearing of the cartilage is a sign. It generally does not create symptoms. In fact, most cartilage has little to no nerve ending, so it's incapable of being the thing that contributes to your pain. But I want you to know that the image doesn't tell you everything. In fact, here's one bit of research. They did X-rays of 10,000 hips. Actually, it was MRIs of 10,000 hips. Most of these people had no hip pain, okay? 80% of people 63 and above had evidence of osteoarthritis. Only 13% of them experienced pain. So that means, what is that? 67% of the people that had this MRI done had osteoarthritis, but had no pain associated with that. And that's true not just of the hip, that's true of the knee, it's true of the back, that's true of the shoulder. The presence of arthritis is much more common than the reality is pain. Here's MRIs of pain-free people. These are asymptomatic people looking at the spine. So you can see age 20, age 40, age 60, age 80. The likelihood of all these issues, disc degeneration, loss of disc height, spondylolisthesis, degeneration of a facet joint, all those things in asymptomatic people are normal, particularly as you get older and older. So 60 and above, it's highly common. So don't be worrying and downtrodden if you've been told, hey, I had an X-ray, it showed some bad stuff on there. That stuff's kind of normal. So pathology and pain are not one and the same. There are way too many false positives with diagnostic tests. So do not get down if you've been told these things. Let's talk very briefly about bone on bone. Some of you in this workshop tonight have probably been told, well, I've been told I got bone on bone. That's a problem. Well, I'm going to tell you that as long as there's still movement available, you do not have bone on bone. At the most, bone on bone is it'd be an exaggeration. There is certainly a loss in most cases of some of the disc space, But if space exists, there's still movement. If you have movement, you do not have bone on bone. And if you did, it would be problematic. Let's talk about your knee, for example. Okay, if you weigh 200 pounds, I'm a little more than 200 pounds. If you weigh 200 pounds, just normal walking, my 200 pounds easily is going to create about 600 pounds of force on my knee. I've heard it's up to 4 times your body weight with every step that you take. Femur, the upper bone on your knee, takes 800 pounds to break. So if you walk a lot, or if you start to walk fast or jog, it's going to easily create enough stress that it would fracture that bone. And fractures of that bone are highly unlikely to occur. So think about how the joint's put together. You've got that capsule around it. You've got ligaments that connect it. You've got muscles and tendons that surround it. Basically, that creates this joint that has space, and it's kind of like it's in suspension. Okay, so the loads kind of pass through all these tissues, but doesn't allow that joint to collapse. And particularly if that joint space is filled with fluid. Now, one of the best things you can do for arthritis is to hydrate yourself. It is estimated that 75% of Americans are chronically dehydrated to some level. And I can guarantee that this is increasing the likelihood that a person has arthritis in the first place, and beyond that, has pain associated with that arthritis. You need to fill that fluid with the most common ingredient by having plenty of hydration in your system. That means water, folks. Water is the best means of hydration. But when you start to lose height, when you don't have enough hydration, when you don't do enough exercise, or maybe eat in a slightly unhealthy way, and in America it's hard not to eat in a slightly unhealthy way because there's so many processed foods. There's inflammation in that synovial fluid, and you lose that disc space, and there's a little bit more friction that occurs. That leads to inflammation, that leads to pain. So you may not have bone on bone, but you could still have tissues that are experiencing inflammation and eventually enough mechanical stress that it causes problems. But I want you to know it's not necessarily, if you have back pain because of arthritis, if you have knee pain because of arthritis, shoulder pain, hand pain, no matter what, it's not necessarily the joint's fault. It's usually the things around it. And we'll talk in more detail in just a little bit about that. But this is the typical cycle of arthritis, okay? So we have pain. That leads to less movement. And because we have less movement, we don't move as well. And when we don't move as well, we don't move as often, we gain weight, which leads to more pain and reduces our movement. And the cycle just gets worse and worse as time goes by. We have to break that cycle. And you could break it by using a pain reliever, but we know that's not the real solution. We've got to move better. Moving better will help us lose weight. And that's how we get out of the cycle. That's how we reverse that cycle. I also want you to know that pressure of the joints, our joints are made to absorb pressure. We are created to live on our feet. We're bipedal. And so joint pressure is normal. In fact, high joint pressures are very normal. The problem exists when that pressure is above our normal threshold and then repeated often enough. That's almost always a mechanical issue. The 3 most common treatments for arthritis. And I'll lead by saying the most common is not necessarily equated with the most effective. The most common easily are medications, injections, and surgeries. I didn't say it earlier, or maybe I did. Surgeries are going up substantially. In the last decade alone, we've more than doubled the amount of surgeries we're doing for arthritic-related problems. It's estimated it's going to continue to go up just because of total joint replacements of the knee and the hip. It's making up a big part of that. These things people believe are going to be effective because in some cases they do reduce pain. But as we talked about earlier, if you don't get to the root of the movement problem, that's fool's gold, okay? We'll talk about joint replacements and pain medication. Unfortunately, 40 to 50% of people who get total joint replacements continue to have pain. That's at least the same, if not worse, than before the surgery. So imagine that. You've been hoping to reduce your pain by having this major surgery. You are 50% or more likely to continue to have similar levels of pain. And I'll tell you why that occurs, because it's not always related to the joint itself. It's the fluid within the joint. It's the kind of movement stress that we experience based upon how efficiently we move. We don't fix any of those things, and we just replace the joint. That same joint can experience stress that leads to pain, okay? By 2030, hip replacement is expected to grow This is, I think, from about 5 years ago, so over 15 years. They expected to grow by 174%, so that's almost tripling it. For those that previously used opioids because of their arthritic pain, even after having a total knee replacement, over half of them continue to use opioids. And even those that didn't use them prior are more likely to be using opioids after surgery. Let me tell you a little bit about opioids. By the way, if you care to, I would strongly encourage you, write this down. Keep the wolves and opioids away. It's a 4.5-minute video. It's about 4 or 5 years old. It was made by a physical therapy group in Colorado. And it's drawing attention in a very powerful way to the opioid problem. There are 2 statistics in that video I want to share with you. Number 1, Americans make up 5% of the world's population. Americans consume 80% of the world's opioids. So that is way out of whack. It's a problem. Now, of course, some of these are illegal. Heroin, for example, is an opioid that people take for recreational purposes. Most of those people, by the way, take it for pain. It might not be physical pain, but pain is definitely an issue. But look at this. When you look at any opioids, you can see accidental deaths, overdose deaths. They've gone way up, okay? They've been ramping up from 2000 through 2012, and then they ramped up significantly through 2016. You might have seen earlier, last year alone, 70,000 people died as a result of accidental opioid death. Yeah, but here's the deal. Heroin makes up a part of it. But oxycodone, hydrocodone, tramadol, all of those are prescription opioids. Now, some of those people have gotten prescriptions for them, and some of those people are using them illegally. Again, most often because of some kind of pain. The other statistics, so we said 5% of Americans in the world, 80% of the consumption. That's a bad deal. The other thing that really stuck out to me is those that get prescriptions, legitimate prescriptions for painkillers, 1 in 4 develop an addiction, 25%. So hear me out, ladies and gentlemen. Opioids are dangerous. They don't help you solve the root of the problem. They kill people, and we need to stop. We need to find another way to deal with it. So you may think I'm getting on a high horse, but I'm going to stay on that high horse because there are answers to this problem that don't involve the unnecessary risks associated with these kind of medications. Here's some other evidence. This is related to surgery. If you're pinning your hopes on surgery, I want to give you the reality, and unfortunately, it's not a great reality. There's actually some surgeries done for people with knee issues, knee arthritis. Half the people that went in actually had arthroscopic surgery, and half of them had a sham surgery. They stuck the scope in there, but didn't do anything. The outcomes were no different. The placebo was just as effective as the surgery was itself, okay? There was another one where they looked at knee surgery for osteoarthritis, and then they compared it just to doing physical therapy, and they found that it was really no different between just doing physical therapy and having the surgery and doing physical therapy, okay? And then they looked at people, this study down here looked at people who had multiple injections of steroids into the knee joint. And all they found is over 2 years, you are more likely to have greater wear and tear in the knee. It didn't reduce pain, and actually because of the increased wear and tear, made them more likely to have surgery, which we now know is not very effective. In fact, the British Journal of Medicine has looked at all the old data and said, we recommend no one to have arthroscopic surgery of the knee anymore. The outcomes don't prove we should be doing it. All right, let me get off my high horse a little bit. Let's talk about causes of arthritis, okay? When I talk about cause, I mean the true culprit. Why is that experiencing not just arthritic changes, but now pain associated with it? So we're going to talk a little bit about hips. We're going to talk about the thoracic spine. We're going to talk about your ankle and foot. So Arlene, I know you have thumb issues. I don't know for sure what's going on with you, but you might actually be having more rheumatic related issues. We're going to get to some of those things. I'm guessing most of you on the workshop tonight, though, are dealing with some kind of extremity, knee, hip, or spine-related arthritis. Those are the most common, and then shoulder issues too. But for all of those conditions, shoulders, backs, knees, hips, these are the most common true causes. Why the hip? Okay, so let's think about it. Today, more than any other generation, we sit. We sit at desks behind computers. We sit in vehicles. We sit. Our hips are flexed all the time. So our hip flexors, the muscles, as you can see right here, major muscles on the front of the hips that come from your pelvis and your spine, they get tight from that shortened position. There are other reasons that those muscles get tight. If your core is weak, those muscles are engaged to provide stability for your spine that you lack because the core is weak. Okay? So anyway, what happens is when those muscles get tight, now you stand up. Those tight muscles now are put on length. And what's going to happen? It pulls on the spine, okay, which is going to add stress to the spine. So for those of you with back issues, that might create lumbar extension, which closes to the facet joints, and those facet joints get more wear and tear, inflammation as a result of that, okay? And also extension of your spine closes the exit point for the nerves that leave your spine and make up your sciatic nerve going down your spine. So this can contribute to back pain and sciatica. By the way, though, poor movement of the hips affects what's above it at the low back. It affects what's below it at the thoracic spine as well. And that same poor movement of the hips can create more rapid issues with regard to hip-related problems too. What about your upper torso? Now, if you can for a moment, I want you to stand up. Just stand up with feet shoulder width apart, okay? Put 50% of your weight on each of your feet. Now, with your mind's eye, okay, I want you to feel your feet on the ground. I want you to feel in your mind's eye the arch of your right foot. What happens to the arch of your right foot when you rotate your shoulders as far as you can to the left? You feel that foot move? What about rotating to the right? That does a little something different to your foot, okay? So movement at one area impacts everything that happens up and down the kinetic chain. And I can tell you thoracic spine tightness, which is quite common, a little bit more so in men than in women, contributes to stress. So I get people that complain of back pain and neck pain. I'm looking at the thoracic spine all the time in people that have those two complaints. That's the common denominator. But believe it or not, these thoracic spine mobility issues can also contribute to movement stresses that create knee wear and tear, and even ankle and foot wear and tear in some cases as well, okay? What about the ankle foot itself? Okay, so think about it again. When you are on your feet, there's normal movement of the ankle, bending and flexing, okay? In and out, pronation, supination. What happens every time we go to a flat foot position when we're bearing weight, when your foot hits the ground, the arch flattens. That's the bones of the foot releasing, and it's creating great contact with the ground, so you're stable and you can feel the ground. As soon as your heel lifts, those bones tighten up, it tightens up your arch, and it becomes a rigid lever for propulsion, okay? But when you're on your feet and you're moving around, if the hips are tight, or if your ankle and foot are tight, the motion that's supposed to happen when you initiate the force of your foot on the ground doesn't happen. And that leads to compensations above it at the knee and at the hip. So quite often we'll see people that are complaining of arthritic pain affecting their knees, their hips, even their spine. It's really an ankle foot issue. Sometimes the ankle foot's too stiff. Sometimes the ankle foot is too flat. It drops too much. So I can tell you this. Many people have arthritis and have no pain. Some people have arthritis with pain. The area that has pain is only the thing that's taking up the slack for something else. And so your back issue, your knee issue is not a back or a knee problem. We got to find the root problem. We got to look beyond. We got to look at those three major issues. Here's some other examples. Okay, what happens to the stress on your back when you can't bend well through your knees or your ankle and feet? This is how a person's supposed to squat to set something on the ground or lift it from the ground. But if you can't bend that well through the ankles or the knees, good luck. Guess what? I'm going to get some compensations. That's going to lead to more significant stressors, movement stressors at your hips and back than what you desire to have. It is compensations that lead to the wear and tear that brings on friction that makes inflammation. And the inflammation causes you to experience pain. Getting rid of the inflammation is not the problem. Getting the movement to become more efficient is the solution. All right? All right, so you're not going to be surprised to hear me say at this point that finding the root cause of the movement issue that's bringing on the stress is the absolute requirement for you getting control of the pain that you have. So reduce your inflammation on medications, injections, and surgery. We know they don't solve the problem. Find the dysfunction. It's a root cause analysis, and that's what I am welcoming you to do. The treatment that we can provide for you is very individualized to your needs. We might have people in the workshop with pain arthritis of the knee. One of them, it might be an ankle foot problem. One of them might be a hip issue. Three of them, it might be a thoracic spine issue. Okay? I can't give you an exercise designed for someone who's caused by the thoracic spine if your problem is really an ankle foot issue. We need to individualize it to your unique needs. And that is step number one. Why are you experiencing pain where you're experiencing pain? Find the real problem that is individualized to you. You can't just look at the joint itself. You got to look beyond. You got to see the entire dynamic system, the entire kinetic chain. And I'm telling you that this whole process should be educational and empowering. When you start the process, it'll look one way, but as you get better, you need new challenges. And that means cumulative issues need to be solved with a cumulative approach. If you're doing the same thing 4 weeks in that you were doing on the first week, that's a problem. You're not going to advance with that. And quite often it requires hands-on care, especially in weight-bearing positions. For example, if your knee is experiencing stress because your hip's inability to rotate, when you're moving on your feet and doing some whole body movements, I as a therapist can help that hip learn how to move better by applying appropriate overpressures to facilitate the efficient motion. So instead of this thing getting worse and worse and worse over time, we're taking the stress away so you get back below that symptom threshold. That's where you want to be, okay? I want to tell you there are also some secret weapons that we have not yet spoken on. This is true whether you have osteoarthritis affecting your knees, hips, and back, or if you have rheumatoid arthritis related issues. Okay, first of all, strengthening is really important. Sometimes that means hand strengthening, wrist strengthening, forearm strengthening for hand related issues. As I said earlier, the research is clear. Mild to moderate strengthening reduces pain and enhances function for arthritic pain related problems. Okay, here's the other thing. The way we eat, I talked about hydration. If any of you are interested, there's a great book called Blue Zones. Okay, the Blue Zones, I got a question coming up here. In a little bit, I will answer that question. But in the Blue Zones, they looked at 5 people groups around the world who lived longer, healthier lives. And they found that there were 7, maybe 9 common habits amongst those people in the Blue Zones. One of them is the way that they eat. They will eat meats, but it's usually the leaner meats, or they reduced some of the red meats. And they had a plant slant, lots of fresh vegetables. By the way, a lot of these places, they also had gardens, because one of the other habits they found was just natural movement was a part of their day, and gardening is a good natural movement part of your day. These nutritional habits, though, and I'm no nutritionist, I know enough to be dangerous and to help you with in combination with your movement-related issues that need to get solved. But these are big parts of reducing inflammation in that synovial fluid. So even in the presence of wear and tear, by changing dietary habits and your hydration habits, the biological markers of inflammation in your synovial fluid will get better, okay? All right, good job. All right, so there's a few problems yet. You've heard a lot. You've probably nodded your head many times. I'm hoping a lot of this stuff resonated with you. The problem is we can't learn everything. You're going to forget most of what I said. And even though I'd like to say knowledge is power, it's not, okay? Knowledge is only powerful if you can do something with it. So I want to give you something that you can do about it. Richard is asking, can you help me with my osteoarthritis in my hip because I don't want to have surgery? Richard, absolutely. In fact, listen up here. I'm going to give you an answer here in just a little bit associated with that. Oh, I'm seeing a lot of people. Earlier, it wasn't telling me people that were asking questions. So now I'm seeing it. Knee pain from Barb, steps, getting worse over several years. Nancy Schwartz, using the hands, gardening, painting, small motor skills, piano. Interesting. Nancy, have you ever been told that you have rheumatoid arthritis related issues? It's a possibility. Arlene, pain most of the time, even just sitting, and that kind of stuff. Yes. So that's the nature of it as well. The problem is, it seems intuitive that if it hurts to move, we should stop moving. But as I said before, when you stop moving, you move more poorly. And your general health worsens as well. And so all too often, unfortunately, stopping moving or moving less does not work the way that we hope it would, okay? Wrist pain, says Barb as well. Arlene, usually about 9 months or so. Okay, Arlene, that's not too long to do something about it for sure. Nancy, shoulders and arms and hands, working at the desk at home. Sandy, thumbs and wrists. We're getting more upper extremity stuff. Lynn, yes, Lynn, and I know you started to get some help already. I know you've had some lumbar issues and some compression fractures. What we've talked about with regard to making sure your knee's doing its job, your hip's doing its job, the thoracic spine is doing its job. I'm sure you're going to get lots of good instruction from the therapist that you're working with about those things. That's the only way to take stress off that back. Okay. Sandy, right knee, unsteady on the feet. Osteoarthritis in the hip, says Richard. Arthritis in the back, says Arlene again. Yeah. You also find too that it's rare for a person to have arthritis in one location, which is an indication that there are likely the same kind of issues can cause problem in lots of different areas. All right, so what does the solution look like? I know some of you are already pursuing care with one of our physical therapists. I want to encourage all of you to do that, and I'm going to give you an opportunity to have what we call a natural arthritis pain relief consultation. And I want to highlight this. This is absolutely free. You get 20 minutes with someone who has a ton of expertise for them to say, okay, this is what hurts, but here's why. Here are the causes for your pain. So what can we do about it? Here's what this would look like. It's a map. We give you a roadmap. Here's where you are. Here's where you can get to be. Here's how you get there. At the very least, hopefully, instead of feeling like you're defeated by this problem, you get some hope. And hope is really, really powerful stuff, okay? I want you to stop wasting time and money on things that do, if anything, something to temporarily reduce the pain. I want you to get real answers so you can stop this insanity. Okay, this time you'd spend with us is valued. National averages anywhere about $150. We're not making you pay anything. In fact, if you do it and you say that was a waste of my time, just tell us and we'll send $150 to your favorite charity. We love doing that kind of thing. We've never had anyone take us up on that. So there's two ways you can take advantage of this offer. You could simply go to that chat box and say, I'm in. I want someone to work with me. Or you can get your phone out. Turn on your, if you have a smartphone, the camera, and put your camera on that little QR code. And if you hold it there a little bit, a little link will come up. You can click on it, and it'll go to this spot on our website. And you can put your name, your email, and then the screen location. So you can pick any one of our 7 clinic locations. For those of you that aren't aware, we're in Ames, we're in Waukee, we're in Des Moines, Newton, Pella, Oskaloosa, and Centerville. So you can pick any one of those 7 clinic locations. Or if you're still more comfortable or it's just not convenient for you to get to one of those locations, there's an online option. There's a telehealth option, which if you're watching this workshop, you'll be able to telehealth with us. But the easiest way to do it is just to say, hey, I'd like to have that, free consultation, okay? So I really encourage you to do that. Because that is the natural next step. Like I said before, it's no cost and no obligation, but it is the only way I can tell you, I know your knee hurts. I understand it's likely due to arthritis. Most of you have probably had an x-ray or an MRI or both to prove that. But the only way to figure out what we can do for you is to figure out what your root cause is. Is it an ankle-foot issue? Is it a hip issue? Is it a thoracic spine issue? Because your unique solutions depend upon us knowing those things. So if you want to take us up on that, go ahead and speak up with that QR code or just put it in that chat button as well. All right, so I'm going to stop share here for a little bit. By the way, let me share that one more time. If you want to see me, this is my phone number. You can write that down. This is my email address. The emails that we sent to you to log in tonight, you can respond to that email as well. That gets to me, so that's all good. All right, Arlene, you're in. Arlene, if you'd like to tell us which clinic location, I'll have that care coordinator give you a call. Emily has never received an email from you about this section we had. Bonnie, okay. Des Moines, Richard, great. We'd love to see you in Des Moines. Bonnie, I'm not sure what you're saying, but Emily, so every now and then the emails that we send off get caught up in people's spam filters. Sometimes that happens. So if that happened to Emily, I apologize about that. If you could, write down my information here, my phone number and my email address, and you can tell Emily. Oh, I know what you're talking about, Bonnie. I know what you're talking about. I tried sending that to Emily, but let me check on that, okay? Thanks for mentioning that. Arlene, okay, we will get you in Impella. Thank you for speaking up about that. Nancy, you want to schedule time? We're happy to get you in too, Nancy. What location would you like? Any other questions any of you have that you'd like me to answer in this format? Nancy, we got you. We'll get you in Newton there, okay? One question I have for somebody is, will Medicare cover this? Okay, so first of all, the screen itself is not going to cost you anything. So that's free for everyone. If you learn that there's a roadmap that you'd like to take and do some physical therapy, we will have our care coordinators check your insurance so you know going into it if there's any financial responsibilities. I will tell you if there's medical justification for it, Medicare is definitely going to cover it. Medicare is the one provider that we work with that does require either a doctor's referral or a signature on our plan of care. So usually what we do, Barb, I think that is kind of cut off. Usually what we do is we'll do that assessment, we'll send that information to your family physician so that they understand what we found and what we intend to do with that to get their approval on that. So if it gets to that point, yes, Medicare will cover that. In fact, you know, most of the group health coverage plans don't even require a Medicare physician's approval on that kind of thing. But I'd say first things first. Initially, I think it'd be good just to spend time in that free screen format to find out what your unique issue is and learn before you make any commitment to anything beyond that, what that would take for you. Anyone else have any questions? I really appreciate you spending an hour or a few more minutes than that with me here today. I wish you well. I know that arthritis and the pain associated with it can be a major problem. Believe me. And thankfully, although I'm sure I have some arthritis, I don't deal with pain with that at this point. My goal is to continue to maintain my mobility to reduce stress so I don't have to experience more of that than what I need to. Richard wants to get back to running. Good, you're doing yoga. That's awesome. Flexibility is exceptionally important for arthritis. Cycling's great too, although I would say, Richard, one of the things we emphasize when we do treatments with people with arthritis is three-dimensional motion. So cycling is good in that if there's less load, less weight bearing on joints with that, especially if it's a lower extremity issue. But cycling is also very sagittal plane. It's like the railroad tracks. And learning how to rotate, learning how to move in the side-to-side plane, those are all ways to take stress off of weight-bearing joints, to reduce the symptoms associated with our arthritic problems. That's pretty important too. It's great though, Richard. I'm glad you've gotten to do that. Sandy, swimming is awesome too. You get resistance from the water, so it provides strength. You're buoyed in the water, so weight-bearing forces in the water are also well contained as a result of that. So swimming is great, especially if you can get into waters that are a little bit warmer. There are arthritis exercise classes held in water. If that water's a little bit warmer than your typical pool water, it's especially beneficial. It helps that motion. Pat, yes, we will get you in Pella. I'll have Laura, our friendly care coordinator there, give you a call tomorrow to set that up. We should have your contact information if you signed up through Zoom, so we will use that to contact you. But knowing that location is great. Awesome. I really appreciate that you're interested in that. Anyone else, if you make up your mind later you want to do it, just reply to the email that we sent to you. You're going to get another email from me here, I think in an hour or so. It will have a link to this video. So if you want to watch it again to review some stuff, you'll be able to do that. If you know family or friends that are dealing with arthritis that would benefit from hearing this information, feel free to forward that email to them. And we would honor those that watch that, any free screen that they want to take us up on as well. So you can do that. So that would be great. And then I really want to keep interacting with you and answer any questions that you have. So just reach out to me. I'll do everything I can to respond. I spent a little time with Barb here in the clinic a couple weeks ago, and Barb's on the road to recover with some of her issues because she decided to take us up on that and ask good questions. So answers start with asking good questions. Thanks again for spending the time with me. Blessings to you. Enjoy the rest of your summer. I look forward to interacting with you more. We'll see you soon.